Just like we did with our external plan, a lot of what we did was done ahead of time. So before it became a definite thing that we were getting an Ebola patient from overseas, we put several things into place ahead of time. We did a lot of advanced planning for how we would communicate this to our staff and to our patients should this possibility become a reality. We knew we wanted our plan to be open, honest, and transparent. We've long held in our organization that our internal communication should run parallel to our external communications, within reason, of course. And we don't want the folks in the public to think that there's something secretive going on behind the scenes that may put them at risk. And on the same side of that, we don't want our internal folks, our colleagues on our staff, to feel like we're giving more information to the public than we're giving to the folks who work here. So we knew we had to get information out in a timely manner, and we wanted to make sure that it was comprehensive and informative and give them the information that they needed to do their jobs safely and effectively. One of the first things we did when it became a really distinct possibility that an Ebola patient was going to be transferred to our facility was we reached out to Emory University. They were actually the first American hospital to receive Ebola patients, and we wanted to talk with them about what worked and what tips and advice they had for us. Their input really was very helpful in the early stages for us continuing to make our plan. So putting our plan into place, we put together four communications that we felt were very important. One, there was a letter to all of our patients that was signed by our chief medical officer, our chief nursing officer, and that was hand-delivered by a nurse to each patient in the hospital and was also available at every clinic location so that folks there could talk with patients and help allay their concerns and maybe even fears about the possibility of having an Ebola patient. We also had a questions and answers document that we gave to all of our what we call our frontline staff, the folks at the front desk of our outpatient clinics, the folks in the call center, and at the information desk at the hospital. That we knew we would have people probably asking, is it safe for me to come to my doctor's appointment? Is my family at risk if they come to visit me? If I have a condition that puts my immunity at risk, am I at a greater risk? And we wanted to equip our staff with the answers to those questions and to have them answer authoritatively and let them know that we're doing everything possible, as we always do, to secure their safety. We also shared with everybody on the staff a memo from our leadership, from our president and CEO, explaining exactly what our role is, why we were involved in this international response, and the fact that their safety was not being put at risk as a result of this. We also supplied everybody in a management role here with a talking points memo that would kind of help them answer questions from their staff when they got back to their departments or their units, that if a member of their team came up and said, hey, I heard this, or is it true that they'd have some answers, even if they don't have clinical knowledge of what Ebola is, but we could equip them with some answers from the experts to take back to their teams. We continually updated staff. We have a weekly email message that's sent out from our president and CEO. That's been an existing communications vehicle that we've had for a long time. And a lot of those messages during this period of time when we had Ebola patients in the hospital, a lot of those messages were updating staff. We also updated staff through our newsletters, our internal newsletters, and any communications to the clinical staff that were appropriate. And again, going back to what I said at the beginning, it was really important to mirror those images with what we were sharing with the public so that we knew our internal staff was getting the same message that the external audience was getting. Looking back, it was a very favorable reaction, and I think a lot of that is due to the fact that we were proactive and we got out in front of this and helped people understand what it was and what it wasn't before there was actually a patient even in our zip code, let alone in our hospital building. And I think it's important to point out also that a lot of this goes to we're able to share as much as we were able to share because we did it with the patients okay. Obviously, with everybody in healthcare knows about HIPAA, and there are certain things you can't share without a patient's permission. There's a lot you can't share without a patient's permission. So we were able to share what we were able to share because our patients said it was okay and asked us to share it actually with the public. In our early communications, one of the points we made with staff was that we reiterated our zero tolerance policy for inappropriately accessing medical records. Looking back, we actually had to let 2 people go who were found to have accessed records inappropriately, and it was a tough lesson to learn, but it's important to drive the point home that is a line that we can't cross. We're very fortunate to have our experts, our infectious disease specialists, our biocontainment team nurses, who were very proactive in getting out in front of this and helping the folks here understand, again, why we're involved, what our role is. And I think, looking back, it was that approach that really helped to turn this into a point of pride for the folks on our staff, that they look back and said, of all the places in the world, these 2 patients came to our facility, so we must have the expertise. We must know what we're doing. It was a very positive reaction, I think, at the end from our staff. And that's not to say that we didn't have some who were at the beginning skeptical or even critical in some cases of our stepping into this. But it's, in the end, I think, has turned out for our organization, has really turned out to be a positive.